Is online learning a new norm? How can students and general population be safe as the kids are going back to school and the college campuses? Hello, I am Rajitha Bommakanti, registered nurse, faith-based holistic coach, and founder of Healthy You Lifestyle Center. If you want to develop healthy habits for life, one step at a time, click the red subscribe button and the bell icon now. In order to learn how to be safe and healthy, join me in my conversation with Dr. Rabbanie. He is joining us from northern India. Okay, let's welcome Dr. Rabbanie. He is joining us from northern India, Kashmir area. And Dr. Rabbanie has been a community medicine physician and a lifestyle medicine physician. And since we have been in the midst of this pandemic, last 7 months, he is very much involved in, um, COVID, the prevention, the precautions, how we keep ourselves safe. And he is educating his community over there and very much involved in international lifestyle medicine too. So, welcome and thank you for taking time to join with us today.
Thank you. Thank you, Rajita, for having me here.
Um, so, that being said, I just wanted to start off the lifestyle medicine. What is lifestyle medicine?
See, everyone is talking about lifestyle medicine these days. Lifestyle medicine is the buzzword. It's something like that hits the root cause of diseases. Lifestyle medicine, as you might have already come across some words like preventive medicine, there's public health, there's community medicine, there's family medicine. Now there's something like that's hitting the non-communicable disease, the chronic diseases part, that's known as lifestyle medicine. This lifestyle medicine actually deals with some parameters, some risk factors which actually lead to such kind of diseases. One among being the physical activity, there is nutrition part, there is the stress, there is the psychological effects and all, and there are some other parameters which are quite easily modifiable, which ultimately influence the outcome. For example, those diseases. For example, these days there's this global burden of hypertension, there's diabetes, then there are other diseases and all, which are all because of our lifestyle, what we are living in. So, for example, in the earlier part of time, we didn't use to have this mobility so easy. So now it has more become easier to travel, but on the other hand, it has led to a sedentary lifestyle, which is incorporated or which has actually turned up as manifested as the diseases like lifestyle diseases. And all of them are actually non communicable diseases. In lifestyle medicine, we both deal at the population level as well as the individual levels. It's like a pure clinics part wherein not only medicines are prescribed, but also there is some lifestyle prescriptions that are being advised to the patients. As for example, earlier there were simple advices coming up from doctors. It wasn't like recorded in the prescription or there wasn't exactly prescribed. Now we have exactly lifestyle medicine prescriptions. For example, as per the exercise, the physical activity, how much of physical activity is required, in which form, which type of exercise is required. Is it like the aerobic, non-aerobic? Is it a resistance exercise? Then how many times you need to do it? Now, it's exactly a calculated approach. In addition to that, the technology has brought in a boom in lifestyle medicine. So it's something that a person, wherein a doctor hands over the health, the parameters of health to the patient himself, and the patient decides what I do, what I need to do with the health. That is actually lifestyle medicine.
Okay, so you're saying, just to understand, let's say I'm a patient, I come to you with
Yeah,
hypertension and diabetes.
yeah,
So to manage that, you prescribe me medicine, but at the same
yeah.
time prescribe me a lifestyle modification, what I need to do,
Absolutely,
like
absolutely.
my activity level, what
Yes,
eating and things like that, so that I'm doing both of them simultaneously, changing
absolutely.
my lifestyle.
See, the evidence-based research and all, whatever is coming up these days, it has been observed even if a person from any suffering from any non-communicable disease, for example, there's diabetes, hypertension, if they continue to be simply on medications and they do not change their lifestyle, they do not incorporate those lifestyle modifications in them, what actually they land up in, they have to undergo an increase in the dosage of medicine, the amount is increased, and then the even the medicines may be increased. From one drug they are switched to two drugs, and then so on and so forth. So now what is required, what is the most essential part, are these lifestyle medicine modifications. Okay, so they are actually the part of that wherein they help in alleviating these problems. So we have actually seen in evidence-based medicine that even if strictly if the patients are adhering to lifestyle modifications, considerably we can scale down the amount of medicines they are being prescribed. We can reduce the dosage, we can reduce the number of medicines, and so on and so forth. It has shown remarkable results.
So at some point, if if patients follow the lifestyle prescription and are consistent with it, taking, being patient,
Yeah.
they can come off the medicines.
Yes, absolutely. They have come. They've just come off the prescriptions. Also, we have n number of patients we have come across, even in connection with our contemporaries in the West, even in India and in other parts of the world. For example, in Lithuania, Lithuania is doing a wonderful job, wherein they have a full-on something like health clubs and all. They operate in a setting and all wherein people are called off, those patients who are volunteering to enroll themselves in those part of research and all, they have clearly seen that if people rigorously follow those lifestyle medicine modifications or rather lifestyle modifications, they actually can come off from the medicine.
Hmm.
This has actually happened.
Wow, that is wonderful. Coming off the medicine, not
Yeah.
dealing with all the side effects that go along with all the medicines, and the chemical ingestion into our body. So
Having said that, it doesn't mean that we will have very quick results and all. It takes time and it needs to be followed rigorously and religiously.
okay, yeah, that that commitment.
Yes, absolutely. It needs commitment.
Okay. And as we can see, I know you said you were involved last 7 months in, our pandemic, the
Yeah,
COVID crisis. So
yeah,
um, that has shown most people that have been had severe consequences from getting the virus is the ones that have underlying conditions, and
yeah,
obesity being one of the big ones out of it.
absolutely. Mhm.
So how are you addressing that issue? You know, with
Okay.
that have underlying conditions and obesity in your area.
Yeah. See, with respect to COVID, it was already projected and all that most people who will be vulnerable to this will be the elderly. There are obviously the young adults. They're also a part of the morbidity and all that people fall in because of COVID and all. So, but the main focus goes to the elderly population. Now we focus certain parameters. For example, at the population levels, it was related to physical activity, wherein different people conducted interviews and all, wherein different people from our organization, even some other people from different parts of the world as lifestyle medicine physicians, they communicated this message to general public that people need to keep a check on their physical activity. For example, with respect to different type of restrictions with respect to mobility, there was a decline in physical mobility of persons.
Mm.
So for what for that was done, messages were being relayed, relate that people need to go for physical activity of at least 30 minutes, even if it means getting involved into activity at their own home. That was required. Then another part was the nutrition. Now, for example, it was already known whenever a person is susceptible or gets vulnerable to certain kind of diseases or infections, what needs to be done is one thing is their simple trick that's called immune boosting and all. Now, for immune boosting, there is a simple diet that you need to follow and all. And for that purpose, there was a message that was being put on to general public. For example, please increase the amount of proteins in your diet. Having said that, it has to be in a balanced way. Then there are some other micronutrients. For example, there is vitamins, there is zinc and all. So there are some foodstuffs that was put up on in a message that they should be increasing them in their diet. So that included proteins, included vitamin C, and then obviously zinc. Now, another part was there, as I said, the elderly population. Now, the fear of death is something that is alarming. Okay, and then it can create a real depression as well as anxiety among public.
I know elderly, but now recently, at least in US, we are seeing our younger population
Yes,
getting, and they keep saying they don't have any underlying conditions yet.
right.
The youngsters and our colleges have opened up,
Yeah.
and kids are going back into the campuses. And
Mm-hmm.
once they have opened up, just in few days the numbers just multiplied.
Multiple
um,
problems.
so even though some are being online, some are in person, but the students are on campus.
Yeah.
What do you have to say about that? How can we manage that?
See, we cannot stick to the already existing way that was being communicated to us that we need to follow social distancing and stay at home. See, life has to go on, but we have to be very cautious, calculate our steps. How do we move forward? Now, we are expecting a vaccine anytime soon, but till then, we need to be cautious. Now, I'll go to the basics that have been communicated again and again to general public all over the globe. For example, from WHO, from all the organizations, health organizations that are putting up the same message. Please maintain physical distancing. Okay, even if it's in a closed setting and all, there should be proper ventilation over there. Then the use of masks is important, what we call universal masking and all. And then there are measures that can be followed in different settings. For example, if there are classes being held, for example, there's recently a guideline that has come up with the conducting of examinations. Things need to evolve. We need to find out solutions. We need to find out ways how can we live and survive with the pandemic. Having said that, I do not clearly say that okay, it's opening of this and that is the correct way of doing it. We need to do it in a staggered way, in a phased manner. Even if their classes need to be conducted, they need to be conducted in a phased manner. Even to the extent, if it's possible to do it digitally, that students can attend their classes from home, let it be like that. But if there are options wherein the physical distancing can be done, wherein the sanitization, hand sanitization, and hand hygiene can be adopted, and then after that, if you have so much of area, and preferably in an open area where there's enough ventilation, okay, then only the classes can be conducted. And thereafter, if the classes are conducted, the students, the teachers, and all the people who are involved in that setup, they need to be educated. The health education with regard to certain simple tricks that we follow in preventive medicine, wherein we communicate that those places, the central spots where there can be exchange of virus, they need to be decontaminated. For example, the doorknobs. Okay, so whenever n number of people enter a particular area, particular closed setting, the first thing they touch, and the highest number of touches goes with the doorknob, the door handle. If there is no automatic door opening whenever a person is there with controlling to sensors, what is the first thing that a person is going to touch? It's a doorknob. So you open, then the second person comes, the third person comes, and this is how the transmission of virus takes place. Second, now when people walk towards from the staircase and all, they touch the hand railings and all. So those need to be disinfected. That needs to be taken care of. People need to be educated that do not touch those hallways, do not touch those walls, the common railings and all. So these are one of the ways we call it in with the medical terminology, contactless living. Okay, so we need to adopt that in our lives, wherein we can minimize anyhow, any way possible, the exchange of virus. And thereafter, if it's possible, in a staggered manner, as I already said, for example, in some countries, what they have said that alteration of the number of students attending a particular class. If that is possible, that can be done. Then, on the other hand, the students also need to take a responsibility. They need to realize back at home they have elderly population. Even if it's being said that young adult is not that much at risk, but yes, they can be carriers, they can be asymptomatic carriers also, and they can transmit this virus back to home. And wherever they go on, if they come across those vulnerable populations who are already morbid, for example, those people suffering from non-communicable diseases, those people suffering from immunosuppressive disorders, or any kind of already existing conditions, those people, this can be a grave threat to their life. So people need to act responsibly. The young adult population, even the students who might be going soon to schools, colleges, universities, they need to act responsibly and maintain the physical distancing, the universal masking and hand hygiene. That is the basic mantra that needs to be followed before we take such a decision that all such kind of educational institutions or offices and all should be thrown open.
So you're saying we don't have to shut it off and send all the students back home, but instead, if they bring in small numbers into
Yeah,
the classroom, spread
yeah,
them apart,
yeah,
and do a regular disinfection of
yeah.
high touch areas like the doorknobs and the side rails, and as you're going up and down the high touch frequency areas,
Yes, yes,
and
yes.
the desks, things like that need to be
Yes, yes.
disinfected.
We need to calculate those risk factors. Are we in a position exactly that we are able to do such kind of decontamination? If we are not, then I'm afraid that we are risking lives. We need to calculate our steps very meticulously. Having said that, if we know that we are not able to follow that, it's better to continue with the digital medium of instruction, to conduct online classes for some time till we know that on the close end we can have those vaccines and all, which would be pretty much quite nearby. Then it is we are at that point of moment. I'll say then we will be in a position to actually take and decide what needs to be done with respect to opening of certain settings. We call these close contact settings where people sit in close together. So it needs to be evaluated whether the measures that I am saying are practically to be followed. Are those people actually who are running those establishments, are they in a position to actually follow these preventive measures and all?
Okay. So these youngsters, even though they're asymptomatic, if they
Yeah,
do go back home or to surroundings where there is either elderly population or somebody that has underlying chronic conditions,
yeah.
they can easily pass the virus on to them.
Absolutely, absolutely. That's why I said they need to act responsibly. And we need to take a call on that, whether actually such behavior change can happen so quickly. Although I believe that such behavior change cannot occur so quickly. We have been trying to put up these messages again and again, follow physical distancing, this and that. But I'm afraid it's not being actually followed so religiously. So, having said that, when we are dealing and we are the outcome and our main motive is saving lives, then we need to be very cautious while taking such steps.
Okay. So if you can tell me a little bit, what is herd immunity?
Yeah, yeah. See, with respect to the concept of herd immunity, it's something like those who are already probably got infected in an attenuated manner, maybe through a vaccine, or even in a regular manner by a natural virus and strain, and then they develop those antibodies and all. Okay, this concept works in certain kind of diseases, but it's not necessary that it will work in every other disease. When we have viruses which can change strain, okay, and which can actually modify the strain types and all. Now we can have antibody against a particular strain, okay, but it's not necessary we have an antibody developed against another strain. So if this herd immunity concept is working in certain kind of disease, for example measles and all, where it has done considerably well, but it does not mean necessary that it will do well in terms of this particular COVID disease. So it's actually those who are immune already, they protect or they create a barrier of transmission of virus in the community. Those people who are susceptible and the virus cannot traverse through, because there is a barrier of created by the immune people to the other susceptible population. But here the problem is that we have seen reinfections happen. Okay, although considerably documented, quite low, but this disease, we see science is evolving with this particular disease also. So we are not in a clear-cut position whether herd immunity would actually help us in protecting the populations and all. So we need to be cautious. For example, I'll quote Mike Ryan, the executive director of WHO. He said herd immunity is actually for herds. Okay, and herds are actually animals. While we are talking about saving human lives, I don't believe that we should be focusing more on herd immunity. We are talking about human lives. Okay.
So some of these people, especially, the youngsters think, okay, I'm just going to go and get infected so that I'm protected. So that's not real answer
No,
to.
no, no, that's not the real picture. See, having said that, there's some other concepts that are coming from different school of thoughts. They're saying what is the chronic effect that COVID is having on people. You yet to evaluate that. Even, okay, fine, a person got infected, okay, he turns up asymptomatic, he recovers after some time, but what is its effect in the chronicity? We are yet to evaluate that. Some say it might lead to restrictive lung disease. Okay, the tidal capacities and all might restricted, or maybe it stays something like, we'll show that we will come to know about that in future. But it's better to follow the preventive measures. As always said, prevention is better than cure. So let's not risk our life as well as the people who are vulnerable and all. I think the young people need to take this message and need to understand. Let's not play with our life and the lives of others. Okay.
Okay. So we have touched a little bit in terms of, for so long, people have been cooped up, isolated
Yeah.
at home. And now, slowly things are opening up and
Mhm.
people are going out. So is is it a responsible way to still kind of enjoy outdoors, have fun, and socialize by being outdoors and maybe staying at a distance and having a different way of having fun? Is that
See,
advisable? What is the way of modification? Because in US, this is almost summer is ending. This is our long weekend. It's unofficial end of
okay.
summer, and
Yeah.
before the winter we get cooped up in the houses. People want to go have fun, and staying indoors, it's just causing a lot more anxiety and
Anxiety. Yeah.
depression and loneliness.
Yeah.
What's the answer?
See, I'll say that that's quite a human nature. Like man is a social animal, as we have been reading this since childhood and all. We like socializing. Okay, but we need to understand that the circumstances where we are in, okay, these days, we need to modify this socializing. For example, if we say there's a family, okay, and we already know that nobody among us is infected and all, there's no harm in getting socialized and all. How long we are going to stay away from each other? Okay, that's fine. If we know that the occupational people involved in certain kind of occupations and they have been taking the protective and the preventive measures considerably, they can socialize. Even to the extent, I would go to the extent of saying that yes, okay, fine, people can go outside in a particular their own car and all, where they again follow the contactless living. That is the modus operandi. Okay, contactless living. They go to a particular place where they know they are not going to come in exchange of other people. Okay, there will be a minimal interaction. There's, and preferably if it's an open air field. Okay, considerably you can say, oh, that's fine, but actually in practical terms that doesn't happen. When people go to a particular spot, a tourist spot or any place where it's like it's for entertainment and all, they come in contact. Okay, and there is exchange and there's transmission of virus happening. So in that particular setting and all, I'll still advise it's better not to turn up to such places. Let's wait for some time. Let's be casual and let's be careful in these terms, where we have to go to such a place where there would be frequent number of people coming and going, and then which can actually lead to again transmission of virus. It's better to avoid such kind of places, even for some time, till we have a shadow, till we see that the vaccine, the news of vaccine is coming up quickly, and we can see the yes, it's going to come up in some time. Till then, let's be patient about it. It's well, I think that would be the best possible solution for now. Even after that, if people want to go, then they need to evaluate whether whichever place they are going, are they in a position where they can maintain the social distance, and they should be following the universal masking and all at that particular point.
Universal masking, and if you go out again, what you have just mentioned, the high touch areas, keeping it those areas clean,
Yeah,
uh, because they're going outdoors and they don't know,
yeah,
even though
absolutely.
it has been clean, you still do not know what
We
other
never
people.
know that. Yes, absolutely, absolutely. And see, people don't remember these things so easily. See, this is a part of behavior change, and your mind needs to make it a reflexive action. Subconscious mind needs to take over. For example, eating food, swimming, and all. We know that, and then once we start doing those particular habits, it gets developed in the subconscious mind. But these universal masking and all, we still forget to wear a mask. We still forget to maintain that physical distance and all. So we need to understand that we are exactly not exactly in that position where we remember these things consciously.
Okay. So we need to have a conscious alert of that, and
Yeah.
maybe use our technology gadgets to remind us, some,
Yes. Yes.
some type of a reminder to keep us going with that for quite
Yes.
some time
There
now.
came lots of gadgets. There were some apps that used to like remind people and all. But you know what happens when people start using those apps and all? After a considerable period of time, human brain starts to neglect such kind of messages. As human nature, the human brain is like channelized like that. For example, earlier there was something like WhatsApp. WhatsApp messages used to come, and then we were like so channelized to check each and every message. But sooner or later, as this thing goes on, we get adapted to it, and then we our mind does not focus so much on it. So same applies to these things and all. So that's why we need to be cautious to be on the safer side. Let's be patient for some time.
Okay, all right. Wonderful. Those were excellent points that you have helped us understand about the lifestyle medicine and what we can do while we are in this phase of the pandemic, how we can protect ourselves and everybody else around us and stay safe. And Dr. Rabbanie, thank you very, very much for your time spending with
Thank you.
us here and giving us great advice.
Thank you. Thanks a lot for this wonderful opportunity.
The take home message is the virus is still around. So we need to protect ourselves and everybody else around us and in the community. Let's be a part of the solution, not a part of the problem, by putting our masks on, staying 6 feet apart, washing our hands regularly, and following all the safety precautions as we are enjoying our life and going along with all the things that we need to do on a daily basis. I am your faith based holistic coach. Until next time, choose the right option